Ladies and gentlemen, for major health reasons, I was not able to travel and be among you as it was my wish and our initial plan. But I am really very happy to join you today through this video address. So let me start by thanking WHO Regional Director for Europe, Dr. Susanna Jacob, as well as Dr. Santino Severoni for their most kind invitation to address this amazing event. Let me also congratulate both of them for organizing this first ever summer school on refugee and migrant health, which for me stands very much for a kind of continuing education opportunity that hopefully will allow participants to enlarge their knowledge about a range of cross-cutting issues relating to management of public health aspects of migrants, to share their experiences and best practices, and to open up new avenues for cooperation. At a time when most of the challenges we are faced with have a global dimension, and when a crisis anywhere is a crisis everywhere, only more collaborative efforts and cooperative solutions will allow us to cope properly with problems and find out appropriate answers. It is my firm conviction that we need more bridges to be built, not walls, because bridges join and connect, whereas walls separate and protect, as once Isaac Newton, one of the greatest minds of history, put it. I know that not all think alike, but my view is that we should take inspiration from this land where in ancient times so many schools of thought flourished, showing how much valuable knowledge and lasting insights came out from logical and critical thinking. Let me just recall some names, such as Archimedes, Pythagoras, and of the Greek mentioned before, Hippocrates, centered here in Magna Graecia. In any case, what I want to underline here is that the added value of the format chosen for this gathering, cannot be congratulated for that, which is a summer school, means that it should, first and foremost, stand for an open platform that will enable participants to break stereotypes, tear down walls, and build bridges. In this regard, this is not only a learning opportunity for participants to deepen their knowledge and, of course, enlarge their expertise, but it should also favor a transformation process that will empower participants to become change makers. The health of migrants and refugees is a core cross-cutting theme that is at the center of the international agenda, as well as in most of our countries at national level. In 2030 Agenda for Sustainable Development, there is a number of goals and targets that directly and indirectly promote migrant health. Let's be honest, there is also some ambivalence since, for instance, the principle of universal health coverage is only an overarching aspirational health goal, and in the case of migrants and refugees, their access to health care largely depends upon their legal status. This is a topic that deserves further discussion. What is at stake is both a question of rights, but also a public health issue. A holistic public health approach to migrant health should ensure migrants' health rights, avoid disparities in health status and access, reduce excess mortality and morbidity, and minimize negative impact of the migration process on migrants' health outcomes. At the global level, it is extremely important to make sure that the Global Compact for Safe, Orderly and Regular Migration, on the one hand, and the Global Compact on Refugees, on the other hand, that are now being developed as part of the follow-up to the 2016 New York Declaration, will both properly address health needs of migrants and refugees. This can be done in two ways, either through integrating health into the various priority strands identified and mainstreaming the migration health agenda in various domains, or through ensuring a dedicated space for health, migration, and refugee issues within the compacts. In any case, the ongoing global discussions make this summer school very timely, and I hope it can contribute to policy development and decision-making at the global, regional, and national levels. Ladies and gentlemen, as you may know, I am a lawyer by training, not a medical doctor, although I have a family medical entourage. My father worked closely in setting up the National Health Service in Portugal, and my brother is a well-known psychiatrist. However, as a politician, I have always had a real keen interest in public health issues. This is why in 2006, after I had finished my second term as President of Portugal, I got a call from Mr. Kofi Annan, then United Nations Secretary General, asking me whether I would like to become his special envoy to stop tuberculosis as part of the Millennium Development Goals agenda. I was rather surprised, but immediately accepted to carry on this stimulating task, although I explained to him that I knew nothing of tuberculosis issues. Indeed, the first steps were dedicated to read dozens of reports in order to learn as much as possible about this global pandemic and to consult with experts from the WHO and the Stop TB Partnership to agree on a plan for action. This was, in fact, the start of a stimulating mission that lasted for 6 years. My main role was not to be played in the medical field, but was aimed at raising public awareness and mobilizing political action to come to grips with the curable and preventable disease that was killing over 1.7 million people each year. Imagine what a shameful carnage. Hands-on into my new mission between 2006 and 2012, I became a kind of globetrotter, visiting almost all high TB-burdened countries, advocating for more public health policies, more research on new vaccines and diagnosis, more means available for more, better and faster public policies to control this global pandemic. One point that has always shocked me over my time in office was to realize to what extent political decision makers knew nothing on this big public health threat and how much this ignorance was sometimes difficult to overcome, very difficult. So, ladies and gentlemen, I told you this personal story just because it helps to underline a number of points of utmost importance that many reports mention, but that I would like to share with you. Number one, countries have a key role to play because at the end of the day, they are responsible for policies and programs that are implemented. More has to be done to make them recognizing that they have to move to a more inclusive and multidimensional approach to migrant health. For that to happen, more and better evidence is needed, more data and best practices disseminated. Thus, enhancing the monitoring of migrant health is, in fact, a priority. Number two, regional cooperation, partnerships, networks, and multi-country frameworks should support migration health dialogues and cooperation across sectors, cross-border cooperation, and among large cities and countries of origin, transit, and destination. Ensuring continuity of care and health responses to emerging needs linked to human mobility and developing platforms for research, innovation, and sharing good practices are also, of course, priorities. Number three, at the global level, I would just add the need to enhance political leadership that ensure that this topic remains high on the agenda, a voice that speaks out and makes clear in all circumstances that addressing health needs of migrants and refugees improves their health status, avoids stigma and long-term health and social costs, protects global public health, facilitates integration, and contributes to social and economic development. I thank you very, very much. And of course, I wish you a very good summer school.